If you're watching this video, you're just like me. You've been on this planet for a while now, and no doubt you have been affected, been impacted by cancer. It could be your own cancer or someone that you dearly loved. My dad was diagnosed with cancer in the early 90s, so lived with it for a few years and then passed away in 1997 because of lung cancer. He's only 57 years old. I've had a bout with skin cancer, very serious. I had to have an operation and a follow-up, but I unfortunately am doing well from that now. But again, we're all impacted by it. And very interesting statistic right now is this. Every minute, folks, of every day, there are 5 people that are impacted with a cancer diagnosis. 5 every single minute. One of those 5 is going to die from cancer. Okay, the other 4 have got a new diagnosis, and I'm talking about every minute of every day. And so that means that 1,700 people die every single day because of cancer. And over 5,500 people every single day are going to get a new diagnosis with cancer. And so it's a huge problem. And what's interesting about those 5 people, only one of the 4 that are going to get a diagnosis every minute is below 55 years old. The rest are above 55. And so from 55 to 65, one of those 4 people are going to get diagnosed with cancer. The other 2 of the 4 are 65 and above, which means what? 2 out of every 4 people that are diagnosed with cancer every single minute, that group is Medicare eligible or on Medicare. They're above 65 years old. So the point is, it's impacting us as we get older. And so there's a higher risk as we age. All right, and so let's talk about the details of getting cancer and what that impact is financially, and of course, what it is it's going to look like if we have Medicare. Just want to read a couple things to you. Normally, when I do my videos, I don't like to do a lot of reading, but I found some articles that I thought would really complement the things that we're talking about today. This one was called Out-of-Pocket Healthcare Expenditures Burden for Medicare Beneficiaries with Cancer. Here's what they say. There is increasing concern regarding the financial burden of care on cancer patients and their families. Medicare beneficiaries often have extensive comorbidities and limited financial resources and may face substantial cost sharing. Medicare beneficiaries with cancer face a higher out-of-pocket burden than their counterparts without cancer. So they're spending more money, obviously, because it costs so much to be treated with cancer. Some of the higher burden was explained by higher comorbidity and also lack of supplemental insurance among those patients. Financial pressure may discourage some elderly patients from pursuing treatment, which is very, very sad. They realize they just simply can't afford it. Now, of that amount of cancer treatment right now, it basically is about $200 billion a year that is spent on cancer treatment. $200 billion a year. I did the math on that. That's $550 million every single day that is going in to treat cancer for the people in the U.S. All right, so again, huge amount of money. Now, of that amount of care, right at a little over 10% of that is actually paid by the patient, which means the government pays a good deal of this, as well as private health insurance. But $21 billion of that annual expense is out-of-pocket expenses by those that are diagnosed with cancer. What's interesting is the bulk of that money is either spent at the beginning when they're first diagnosed or at the end before they pass away. Okay, and so we know it's going to be very expensive. Another statement here I thought was very interesting. As the cost of cancer treatment continues to rise, greater attention to addressing patient medical financial hardship, including difficulty paying medical bills, high levels of financial distress, and delaying care or foregoing care altogether because of cost, is warranted. They go on to say analysis of the differences in patient economic burden by cancer type found substantial variation in patients' out-of-pocket cost, reflecting differences in treatment, intensity, and duration, as well as survival. So all these things go into these numbers. Out-of-pocket costs were the highest for those diagnosed with breast cancer. That was $3 billion annually. Prostate cancer, $2.26 billion, colorectal cancer, $1.46 billion, and lung cancer, $1.35 billion. They go on to say, in the modern era of cancer research, we have to think about treatment cost and how they impact our patients. As exciting and promising as cancer research is, we are keenly aware of the issue of financial toxicity for these patients. therapies that are highly effective are no doubt good news, but if they're unaffordable, it is not the total kind of progress that we would like to see. All right, so his whole point in this article is to make sure that, yes, these treatments are exciting, but they're also very expensive, and for some people, it's going to be a deterrent for them for getting the treatment that they need. All right, and so obviously we all know the cost of cancer is growing rapidly, the cost of treatment growing rapidly as well. All right, so let's talk about what happens now when we're on Medicare and we get diagnosed with cancer. So let's do just a quick review. When we go on Medicare, and by the way, most people are going to do that at 65 unless you or your spouse are still working. Covered by a plan that has 20 employees or more, you have to go on Medicare at 65. Now, you or your spouse still working, either one of you have a group plan at work, 20 employees or more, you don't have to do anything with Medicare, A or B. So as I address you, I'm talking about those of you that have started Medicare at 65, or now you're ready to retire and you're going on Medicare. And so when we go on Medicare, there's only really three ways in which we can use our Medicare, three possible ways. So let me break them down this way. You can choose to stay in Medicare A and B only. You can choose to get A and B with a supplemental plan to fill in the gaps, or you can choose to do what's called a C plan or a replacement plan called Medicare Advantage plans. That's it. A and B only, A and B with a supplemental plan. Medicare Advantage plan replaces A and B. And so let's look at those three scenarios. So if you have A and B only, which I think is the worst choice that a person can make. And the reason for that is because you're responsible for all the gaps that Medicare doesn't pay. Now, Medicare pays decently, A and B, but it doesn't pay for anything 100% other than preventive care. So if it's not preventive, and certainly we're talking about cancer treatment today, it's not going to be preventive care. There is wonderful preventive screenings available by Medicare. Those will be covered 100%. But if I get diagnosed, I'm not going to be covered 100%. So if I have A and B, what's going to happen is you're going to be responsible for all the financial gaps. Okay, Medicare has two parts, A and B. A is inpatient, hospital and skilled nursing. B is outpatient and all doctor services. And so in each of those systems, we have financial gaps. And so in the A of Medicare, we have a deductible this year at $1,600. It's not annual. It could be paid multiple times in a year. After we meet our deductible, if we happen to be in the hospital longer than 60 days, that's our second gap, which are called extended hospital copays. Month 3, it's $400 a day to you. Month 4 and month 5 is $800 a day to you. And so that's that gap. And then the last gap on A is the skilled nursing facility for inpatient rehab. That could happen for sure after some type of cancer surgery. And so the way that works, first 20 days, Medicare says they'll cover everything in the skilled nursing facility as long as you were in the hospital 3 full days prior. Okay, 3 full days prior, Medicare covers everything. First 20 doesn't cost you anything. After that, we have 80 more days covered in the skilled nursing facility, but we're responsible for a $200 a day copay. That's the 3 gaps on the A. The 3 gaps on the B are a small deductible on the B. This year is $226. It's not multiple times in the year. It's once a calendar year. And after that, Medicare pays 80% of the bill, and you pay 20%. Now, the problem with your 20%, especially if I get cancer, every time I see a doctor, Medicare only pays 80%. I got to pay the doctor 20%. Every primary care doctor visit, every specialist visit you have, if you have a surgery, the oncologist, the surgeon, the anesthesiologist, you have to pay them 20%. And that 20% never stops. It just keeps going and going. That's really the biggest risk if you get cancer is that 20% coinsurance. And then lastly, we have a thing called an excess charge. And this is when you see a Medicare doctor, but that Medicare adds to the bill. They can legally do it. It's 15%. And when they do it, you have to pay for it. And I can assure you there's a lot of providers in the cancer business, oncologists and specialists and cancer centers that are going to add that 15% to the bill. And so you would have to pay for that. So my point is there's 6 gaps in original Medicare. So if you're A and B only, you're responsible for all of those. And frankly, that's what puts people into bankruptcy. And because it's very difficult for a lot of people to be out of pocket for that full 20%. And so most people don't do A and B, but those who do, that's an option. So the ones who decide not to have A and B only, they will get a supplemental plan to fill in the gaps. And I'm only going to mention 2. There's 10 plans. The top 2 are the G plan and the N plan. And the G plan is the most popular. And the reason for that is because it fills in 5 of the 6 gaps. So if you go to the hospital, you have full coverage. If you have any kind of a surgery, full coverage other than that small B deductible, $226 once a year. So every time you see a doctor, an oncologist, a specialist, a surgeon, an anesthesiologist, the only thing you'd have to pay is that $226 once a year. And after that, you have full coverage All right. And so you have very little out of pocket. You got to pay a premium. Right now, the average is about $125 a month. That's, give or take, depending upon where you live in the country. But it's about $125 a month. So what's it cost you? About $1,500 a year for that G premium. But the good news is you paid the premium, but the good news is you transferred all the liability of these gaps in Medicare to the insurance company. You don't have to pay out of pocket other than that small B deductible. All right. And so if you go through treatment, you're going to see a lot of doctors. You're probably going to have a surgery, certainly chemotherapy, radiation, all that's covered other than the B deductible once a year by that supplemental plan. Hey, just real quickly, if you're finding this video to be helpful, you can like, comment, and subscribe. And if you do so, that'll let YouTube know that this is helpful information, and they'll send it out to others who also need to learn about Medicare. The N plan is the second most popular plan. Again, you'd be out of pocket the B deductible, $226, but with the N plan, it does not cover excess charges. So if you go to a cancer center, especially a doc that takes Medicare but won't take Medicare as payment in full, they're going to add to the bill that 15%. You would have to pay for that if you had the N plan. Now, the N plan is going to be probably $30 a month cheaper, but again, you got to take on the risk of that. Plus, with the N plan, every time you see a doctor, you're subject to a $20 copay. You'll see multiple doctors. So my whole point is we look at these plans, you have to decide, are you comfortable with the risk of that? Most people today say, I don't want that much risk, and they go with the G plan. So that's A and B option, A and B with a supplemental plan, either a G or an N, or you can do an Advantage plan. Those are called replacement plans. And as I share this with you, I just want to make sure you know that this matters because when you make a decision to go on Medicare, it's one of these three choices. Again, about 10% of all people choose A and B only. Of the rest of those, about half go on supplemental plans and half go on Advantage plans. And so with the Advantage plan, what you're doing is you're enrolling into a private health insurance company's plan instead of having Medicare and the Medicare system, processing claims and paying bills and all that. Now you have a private health insurance company that replaces Medicare for you. And the majority of people that go on Advantage plan do so because the Advantage plans have either zero or very low premium. And so they like the fact that they can have a zero premium plan, and they also, Advantage plans throw in some perks that original Medicare doesn't offer. Now, you still have to pay your Medicare B premium, whether you have a supplemental plan or A and B only or the Advantage plan. They all have that in common. You got to pay Medicare. This year, it's $164.90 a month for most people. So there is a premium on the Advantage plan. You have to pay to Medicare, but the insurance company, doesn't charge you a premium. Why is that? Well, because instead of paying a premium, now what you're doing is you pay as you go. So you don't know for sure what your healthcare expenses will be because you don't know what the future holds, but you'll just simply pay as you go until you hit a max out of pocket. And so what I'm going to do is just want to compare these two systems because, again, most people don't have A and B only. They're going to either do the SUP or they're going to do the Advantage. So what is our cancer care going to look like in these two systems? Because it is definitely going to be different. And so let's talk first about the differences. And the number one difference is when it comes to providers. If you get diagnosed with cancer, no doubt you're going to probably see a lot of docs, specialists, oncologists. And so if you have a supplemental plan, you can go to any doctor that takes Medicare. As long as they take A and B, they have to take your supplemental plan. So it's almost, frankly, unlimited provider choices. Now, if I have an Advantage plan, it won't be that way because Advantage plans, the way they work is they put together a network of providers, hospitals and doctors, oncologists and specialists, and either see an HMO network or PPO. Now, the HMO network is going to be smaller than the PPO. The HMO network also requires you to stay in their network. You can't go outside the network. If you do, they won't pay anything. You got to stay in your network for them to cover you. Now, the PPO lets you go out, but it's going to cost you more. Now, right now, as we look at these Medicare Advantage plans, the average, I'm talking about average across the country, max out of pocket for the year is right around $5,000. That means that though I don't pay a premium, I pay copay, and all those copays go to my max out of pocket. If I reach my max out of pocket, I'm done for the year. And then the max out of pocket will reset every January. So my out-of-pocket expense on the Advantage is not a premium, it's copays and coinsurance and sometimes deductibles to be on those plans. And so those plans are structured differently than a supplemental plan. Supplemental plan, I didn't have a lot of copays because I paid a premium and got rid of all that liability. And so with that Advantage plan, you'll be out of pocket till you hit the max. Now, Medicare always sets the max for the year. Again, the average right now is about $5,000. The max that a company could charge, and some do, this year, 2023 is $8,300. Okay, if you go out of network, they can go to $12,000. I think it's $450. So if you go out like you could on a PPO, then you're going to spend more money. So you have to decide: is it worth it to take on the risk of pay-as-you-go? And certainly, if you get cancer, it's very obvious which one of those you'd be less out of pocket. And so when people have supplemental plans, they're not going to spend a whole lot of money because they paid in advance, and now they have that kind of coverage. So that's one issue. It's either pay a premium or pay as you go. You decide which will be best for you if you got cancer. Second issue is going to be the issue with the providers. Remember, original Medicare with the supplemental plan, go wherever you want. Advantage plan, we're going to have network providers. All right. But here's the issue that's really key, and that is if I get cancer, I'm on the Advantage plan, many of the services I'm going to need are going to have to be pre-approved because Advantage plans have the right to deny a service the doctor says you need, or they can approve it. And so that's called a pre-authorization. And this is probably one of the biggest issues going on right now with Advantage plans, these whole pre-authorizations. And so let me explain what that means. It means you need some kind of healthcare service that's beyond just a primary care doctor visit or a specialist visit. You may need an MRI, you may need a CAT scan. Certainly you'll need many of those when you're being treated for cancer. You need probably go to the hospital and be operated on. That's going to require a prior approval, pre-authorization. You go to a skilled nursing facility, it's got to be pre-approved. And so you will not have a pre-approval process with original Medicare and a supplemental plan. If Medicare says you need this treatment and will cover it, then doctor says this is what we're prescribing, it's end of story. You don't have any insurance company involvement whatsoever. It's Medicare and your doctor make all the rules and the determinations of care. If you have an Advantage plan, it's not that. Doctor can make a recommendation, but that private health insurance company has the final say so. They have to approve of that. And sometimes they do approve those things immediately, but sometimes they delay those. They put it off for a week or two. Well, if you're going through cancer treatment and they delay that, that's going to have an impact upon your health. And not only the frustration of it, but also what's a cancer doing within your body. And sometimes they just simply flat deny it. Okay. In fact, some interesting stats on this. There's 35 million pre-authorizations that went through last year for people that were on Medicare Advantage plans. Okay. So that's things doctors said we need, but the insurance company had to agree. And again, the majority of them, they are going to agree, but sometimes they deny it. People have to appeal it, and there's an appeal process. It's delayed coverage, or sometimes they just simply say no. And so you have to decide when you go on Medicare, how do you want your cancer to be covered? Would you like to go to any provider that takes Medicare? Do you want your doctor and you and Medicare to make the decisions, not the insurance company? You see, that's what happens when you choose a plan. You're deciding all that in advance. Okay, so let me just kind of wrap this up with a couple things. I do want to mention this. Be sure, folks, that you know when it comes to these two systems, both of them will give you opportunities for cancer screening. And again, that's one of the greatest ways to reduce the cost of cancer is for early detection. And that's why screenings are so important. And again, original Medicare and the Advantage plans will do this. So you're eligible for this. So take advantage of the screening. One is, of course, breast cancer screening. These are called mammograms. And every lady is eligible for a screening mammogram once every 12 months. And of course, if you have ongoing issues, then you may get those more frequently, like a diagnostic type of a mammogram. But the point is, those are covered by Medicare and the Advantage plans. Cervical cancer screening. And so this would be where the Pap test, the Pap smears come into the picture. And ladies are eligible for these every 24 months. Some more if you have a history of some problems. You can certainly get those more. Again, no cost to you. Colorectal screenings. Now, the full-blown colonoscopy, most people get every 10 years, but there's a variety of these kind of tests. If you're high risk, then you can certainly get more of these. But again, you want to take advantage of that because that's the best treatment. And then we have lung cancer screenings, eligible for these as well, and then prostate cancer screenings that Medicare and the Advantage plans will pay for. All right, so that's going to be the same. So let's talk about now when we're on an Advantage plan versus a supplemental plan and we have cancer. Let me just read a couple statements from this article, and then I'll wrap this up. This gentleman who writes this article, by the way, this is out of the magazine on oncology called Managed Healthcare Executive. It says perhaps one of the most consequential changes in healthcare insurance in recent years has been the growing number of Medicare beneficiaries choosing to enroll in Medicare Advantage plans. In 2008, just 9 million beneficiaries were enrolled in Medicare Advantage. Compared to 2022, that number has now more than tripled to 28 million. meaning 40% of all people on Medicare have an Advantage plan. And so the appeal of Medicare Advantage plans is understandable. It includes a low or even no premium added benefits such as dental and vision. Now, the principal drawback is that coverage is limited to services from providers in the plan's network. That's what I shared with you. An Advantage plan is always going to be a network plan, HMO or PPO. Not all doctors take the plan. Some take none, but some may take all, I'll be on the PPO and not the HMO, or vice versa. They'll say, I'll take the HMO, but not the PPO. All right, and so you have to deal with that. They go on to say this. I thought this was an interesting quote. It says, as with all types of insurance, any kind of insurance, but perhaps especially health insurance, people will not experience the disadvantage of low premium coverage until they need services and start bumping up against limitations. Hey, we all like something that's cheap until all of a sudden now we need that insurance to work for us, but now we have problems. And that's when we realize we got what we paid for. And that's what he's saying. Now, he says whether it is a good choice for certain groups of patients or whether they, to be on an Advantage plan or whether they would be better served by staying in the traditional Medicare system is really the decision. Patients with cancer are at the top of that list of those who are disappointed, is what he's saying, because they tend to be heavy users of healthcare services for obvious reasons, and because cancer is a disease that disproportionately affects older people and therefore the Medicare population. Medicare has out-of-pocket limits, which will be especially important for patients with cancer because the cost of treatment is so high. I had this happen with one of my clients. She got diagnosed with breast cancer towards the end of a year, a couple years ago, $6,700 max out of pocket. She maxed out. Surgery, chemotherapy, radiation, maxes out. Well, her cancer treatment wasn't over. We carried into the next year, and the max out of pockets reset. And so, again, another $6,700 that she spent within a matter of a couple months because cancer treatment is so expensive. So she spent $13,400 within a matter of less than 6 months period of time. She maxed out twice. All right, didn't save any money whatsoever. Anyways, he goes on to say the negatives of Medicare Advantage for patients with cancers are the limited provider networks, which may leave out cancer centers and academic medical centers. Another negative from MA plans is that networks may be limited to metropolitan areas or regions, meaning there could be strong in a metro area, big city, but not so good out in rural areas. And so the whole point is when someone enrolls into an Advantage plan, they have to realize that with that is going to have restrictions and limitations for networks as well as these prior authorizations. This article talks about this. It says here, that they did some stats on this, and they said that for 2019, the most recent numbers they had available, of the 15 top Medicare Advantage organizations, they denied almost 85,000 prior authorizations were denied. And those included imaging services, post-acute care and skilled nursing facilities, inpatient rehab services were among the most prominent services that were denied. And what's interesting about that report is that in many of those cases, those would have been approved by Medicare. And of course, a Med Sup plan would have followed Medicare anyway. So a person enrolled in a supplemental plan would not have had to deal with that. Okay? And so again, we want to make sure that we realize that when we make a decision to go on Medicare, that we're deciding how will our cancer be treated. All right? And so MA enrollees are less likely to also be treated at top-ranked cancer hospitals than those that have traditional Medicare as an option. Why is that? Because those hospitals sometimes are not going to take your Advantage plans. Okay? And so you definitely have restrictions to providers. You have all these pre-authorizations, prior approvals, and those could be a real problem for you with your cancer treatment.
Hey, if you're finding this video helpful, I want to invite you to go right up here and actually click on a link that will allow you to watch what I call the Medicare Essentials Workshop. It's a workshop that I did that really is going to show you everything you need to know about Medicare from A to Z, how to enroll, when to enroll, and the plan options for you. So go to that link and check it out.
Okay, and so again, I've just tried to share with you what it's going to look like if you get cancer. How is your insurance going to work? Okay, is it not just about the low cost premium? It's going to be, can I go to the doctors I want to go to? Can I get the services I want when I want them? Or I'm going to have to jump through a bunch of hoops before the insurance company is going to pay. And those are the kind of things you have to live with. Secondly, we want to make sure that the financial burdens of these things do not impact your health. You're unhealthy enough as it is with cancer. You don't want the stress of these financial problems facing you either. All right, and so think it through. Be sure that when you go on Medicare, you're picking a plan that's going going to cover you very well if you get cancer. Why? Because 2 out of 4 people getting diagnosed right now are Medicare eligible.